Good afternoon, everyone. Today we are gonna discuss a condition which is known as acute kidney injury. Okay, so what we are gonna discuss acute kidney injury. What is acute kidney injury? What does it mean, acute kidney injury? So I am going to share whiteboard with you. So please confirm, is it visible? So what's our topic today, which is known as acute kidney injury? Acute kidney injury. We are gonna discuss today what topic which is known as acute kidney injury. So what does it mean, acute kidney injury? What's its definition? So kidneys, what's kidneys function? Kidneys function is to filter our blood. And also kidneys function is to make electrolyte balance and excrete out waste from our body through in the form of urine. Okay. So acute kidney injury, what happens in acute kidney injury? There is a sudden decrease in kidney functions. What? Sudden decrease in kidney functions. So before this, we should be aware of what normal kidney functions are. What normal kidney functions are. So we can say first function of kidney to excrete out waste from our body, waste or toxins, waste or toxins from our body. And another functions of kidneys, another normal kidney function. What is another normal kidney function? To excrete out fluid, और हम कह सकते हैं, और we can say extra fluid from body. Okay. So what are we discussing? Normal kidneys function. First I said normal kidneys function is to excrete out waste toxins from our body. And second, I discussed that kidney functions, normal kidney function is to excrete out fluid or extra fluid from our body. Okay, we can also say normal kidney function. What could be it? To maintain electrolytes balance, to maintain electrolyte balance. Okay. So when we are discussing, so when we are discussing acute kidney injury, okay, so I said sudden decrease in kidney functions. What does it mean? Sudden decrease in kidney functions. What does it mean? Means kidney functions which we discussed recently, normal kidney functions, that would be impaired. That would be impaired means fluid wouldn't be excreted out. So we can see fluid build up in body. Fluid build up in body. Okay. We can see as a manifestation of acute kidney injury what fluid build up in body, and also waste accumulation. waste accumulation, because normal kidneys function was to excrete out waste. Now it's disease condition, acute kidney injury, so waste would not be excreted. So we can see waste accumulation in blood, because blood is not filtering, kidneys are not filtering blood, kidneys are not functioning or not able to function like it should be. Okay, so waste accumulation. And third one we can see also electrolyte imbalance. What can we see? Electrolyte imbalance, because the hemostasis or electrolyte balance are maintained by kidneys. So we said in definition what? Sudden decrease in kidneys function. So when there is sudden decrease in kidneys function, we can say there will be a fluid buildup in body, waste accumulation in bloods, and electrolyte imbalance. Okay, waste accumulation, like we can say blood urea, nitrogen, or we can see creatinine, which are the end products of, like end product or waste product किसके होते हैं? Waste product of muscles or protein breakdown, muscles and protein breakdown broke down. Okay, so what we said, that there will be a fluid buildup in body. Second one, waste accumulation. Waste accumulation means Bu and creatinine and other wastes will be accumulated in our body or blood. What is Bu and creatinine? It's the end product or waste product. We can say waste product of muscle or protein breakdown. And third findings or third manifestation, we can say electrolyte imbalance. Okay, so we will discuss them further. First, we are going to discuss causes. What causes acute kidney injury? What are the factors which causes acute kidney injury? So, based on locations, we have classified them. Based on locations, we have classified the causes of acute kidney injury. So, first one is based on location. So, first one is pre-renal. What does it mean? Pre-renal. What does it mean? Pre-renal means before the kidneys. Okay, let me show you diagram, and this is our kidneys. Okay, this is our kidneys. This is our kidney. This is aorta. We can say aorta. This is aorta. Okay, which carries blood from heart to kidneys, and this is a renal artery. And before the aorta, there will be heart. Okay, I am making superficial diagrams so we can understand it. Okay, so I said pre-renal cause. Pre-renal cause. What does it mean? Before the renal means before the kidneys. I am highlighting what I am saying. Okay, before the kidneys. So before the kidneys, if there is a problem in heart, if there is a problem in heart, if there is a problem in heart muscles, or if there is a problem in body, like we can say example, if heart muscles like myocardium, what is the function of myocardium? Its function is to contract and relaxation, and to contract to excrete out blood from heart to aorta. What does it shifts? It shifts blood from heart to aorta. Okay, which is known as we can say cardiac output. It regulates cardiac output by contracting. Okay, it pushes blood from heart then to aorta. And aorta, what aorta carries blood and gives it all over body. So we are here saying about renal or kidneys. Okay. So what happens? Myocardium disease, or we can say myocardial infarction. If there is a myocardial infarction or myocardium layer disease, so myocardium will not be contract properly. If it will not be contract properly, so there will be a decreased cardiac output. So the blood going to kidneys will be decreased. Blood going to kidneys will be decreased. So there will be hypoperfusion. What? There will be hypoperfusion. Hypoperfusion in kidneys. Hypoperfusion means decreased blood supply to kidneys because myocardium muscles was not contracting properly. So there will be a hypoperfusion, decreased blood supply to kidneys, which causes nephrons to damage. Nephrons are the functional unit of kidneys that will be damaged. If they will be damaged, so what does it cause? It will cause acute kidney injury. It will interrupt what is the function of nephrons to filter. So interruption of filtration. What it causes? Interruption of filtration or inappropriate filtration, which causes acute kidney injury. So we are going back to the causes. I said pre-renal causes. Before the kidneys, we can say myocardial infarction. Second one, we can say if there is a hypovolemia in body. What hypovolemia means? Blood vessels have less blood. What? Blood vessels have less blood. So in heart there will be a less blood. If there will be a less blood, so decreased cardiac output, and the left ventricle will have decreased blood. And when myocardium contracts, so it will excretes less blood to aorta. So there will be a decreased blood in aorta, which causes decreases cardiac output. And kidneys receive 20 to 25% of cardiac output. So there will be a decreased blood supply to kidneys that could damage the kidneys, could cause the acute kidney injury. So first cause we said MI, second we said hypovolemia. Okay, third one we can say cardiac issues or hypovolemic shock. We can say myocardium muscles or damage to cardiac muscles. Okay, so let's move on to next. We can say dehydration. Dehydration also leads to with excessive vomiting and diarrhea. If there will be a dehydration with excessive vomiting and diarrhea, it can also lead to decreased volume in bloods, which can lead to decreased cardiac output. Okay. So next move on to, also there will be a one condition, burners. In burners there will be a fluid loss. Because of tissue damage, there will be a fluid loss. Okay, which leads to hypovolemia, which further leads to decreased cardiac output, which leads to decreased renal blood supply, and which further leads to acute kidney injury. So I hope you guys understand what does it does it mean pre-renal cause. So next we further move on to intrarenal. What does intrarenal cause mean? Can anyone Explain what does intrarenal. Okay, intrarenal. We can say tubules necrosis, or we can say prolonged prerenal ischemia. Ischemia. Like we discussed, let me explain this. We discussed that there will be a MI, myocardial infarction, which causes decreased cardiac output. So if it was for long time, so decreased blood perfusion to kidneys for prolonged time. Okay, for prolonged time, which could lead to nephrons. In nephrons, there are tubules like PCT, DCT, collecting duct, and others that will be damaged. So that can cause intrarenal in the kidney. In the kidney, there will be a damage. As I said, tubular necrosis or prolonged ischemia. Okay, third one we can say nephrotoxic drugs. We can say nephrotoxic drugs. Okay, what does it mean? There are many drugs which are nephrotoxic, okay, which causes if we are using them for prolonged time, or we are using them for excessive time, or we are using them excessively, so they can damage our kidneys because kidneys are excreting out waste from drugs, or drugs excreting out drugs. Kidneys and liver, what does it do? They metabolize drugs. After drugs work, they excrete them in the form of urine and in the form of stool. So many drugs that can cause injury to kidneys, we can write them NSAIDs. If we are using them excessively and for prolonged time, they can cause acute kidney injury. Aminoglycosides, or we can say antibiotics. Okay. Next one we can say chemotherapeutic drugs, which are we are using in cancer. Therapy drugs. They are also nephrotoxic drugs. Contrast dye. Contrast dye is used in both procedures, more procedures like CT scan, we can say, IVP, intravenous pylograph, or other procedures, another procedures. Okay. So when we use contrast dye, we say client what? We say to client that increase fluid intake, because these are, if they retain in kidneys, they can cause acute kidney injury. So if we are using prolonged excessively contrast dry, or not increasing fluid intake after using contrast dry, that can lead to acute kidney injury. Okay. So also infectious disease can cause, we can say, glomerulonephritis, which we are going to discuss in renal system further. And we can say direct injury to kidneys, if there will be a trauma or blunt injury to kidneys, that can lead to acute kidney injury. So this was intrarenal cause. Intrarenal, in the renal, first one I said tubular necrosis, then I said prolonged prerenal ischemia. Okay. Then I said NSAIDs and aminoglycosides, antibiotics. Then I said chemotherapy drugs and contrast dye. Okay, which are used in CT scan. Okay, infection disease like glomerulonephritis, which are we are going discussing further in next topic. Then injury to kidney. Okay, so Let's move on to next causes. We can say post renal. Okay, what does it mean after the kidneys? So let me make it for you. So there are two kidneys and then two ureters which carries urine from kidneys to urinary bladder. Then there is a small part which excretes out urine, which we which we call as urethra. Okay, if there is a problem in urinary bladder or ureters from this renal pelvis to after the kidneys, there is a problem in ureters, urethra, or urinary bladder. We call them post-renal cause. So in this we can say stones or calculus. We can say calculus in ureter or urinary bladder. Okay, so another cause is benign prostate hyperplasia. What does it mean? Benign prostate hyperplasia, or we can say prostate gland hyper enlargement. Okay, what does it mean? It's a gland which, what does it mean? It's a gland, it's around the urethra. In males, it's present around the urethra. So when we see there is a gland hyperplasia or hypertrophy or hyperenlargement, it squeezes urethra because it's around the urethra. It squeezes urethra and decrease urine flow. When there is a decrease in urine flow, the toxins will accumulate. They can backflow to the urinary bladder. Then, like we said, urinary calcus, there was a ureter calcus. They also causes urinary backflow to the kidneys that can cause acute kidney injury. Like this, what does it cause? Squeezes urethra, then urine flow decrease and backflow happens, which causes toxins accumulation, which can lead to acute kidney injury. I hope you understand this. So we are gonna stop this session, today's session.